studies out are helping medical providers take important steps forward in understanding the link between the gut bacteria, what we eat, and how we feel. Joining me now is Dr. Cathleen Gerenger, who concentrates on functional medicine, to tell us more about the link between the gut and the brain. Dr. Cathleen, it's always so great to see you.
It's great to see you, Gail.
So, you know, I'm glad we're talking about this a lot on Bloom, because people don't realize there's a direct link, and there's a reason they call the gut our second brain.
Yes, and it goes the other way too. Our brain is also our gut. So it goes in and out. It's a two-way street.
So talk to me about the vagus nerve and how that plays into everything.
The vagus nerve is part of our autonomic nervous system. So we have our central nervous system, which is our brain, and then we have something called the autonomic nervous system. We have something called the sympathetic nervous system and the parasympathetic nervous system. So when we talk about the vagus nerve, it's part of our parasympathetic nervous system.
So how can we know that we might be having issues?
Well, one of the signs where you can actually detect your vagus nerve is that when you get nervous, when you have these butterflies in your stomach, it's your brain sending these messages that's saying, oh my gosh, I'm going to be on TV, or I have to do a speech.
That's really, really interesting. But if this is a chronic problem and you're having gut issues, are there any other telltale signs?
Yes, like depression, anxiety, digestion. All those are signs and symptoms of your vagus nerve being that miscommunication between your gut and your brain.
And you say that there are some affordable scans on the marketplace right now that can help medical providers like yourself.
Yeah, so we call it the heart rate variance. What that does is that it measures your heart rate, because that correlates to the vagus nerve, which is part of our parasympathetic nervous system.
What's the neural check?
The neural check is one of those scans that we're actually place it on your wrist, and I think we did it at the office.
Yeah, we have some video there of me doing it.
And what that does is that it measures your heart rate, because the parasympathetic nervous system is what we call the rest and digest, whereas the sympathetic nervous system, what we always hear about, is called the fight or flight response.
Yeah, which a lot of us unfortunately live in, you know, day after day after day, and that's when it gets not healthy. So how do we take care of our vagus nerve?
What we need to do is rest and digest. What that means is that when you eat food, it sends a message to your brain to say, hey, let me go ahead and send these digestive enzymes from your pancreas to break down the food, so it's be able to absorb through your intestinal tract to deliver the nutrients to your major organ, which is your brain.
Very interesting. And you talk about the types of foods that your patients should be eating all the time.
Oh, I love talking about niacin, and niacin is found in a lot of foods and fruits and vegetables too, but one of my favorite one is beets, and there's red beets and there's golden beets, and golden beets has a lot of high amount of what we call folic acid in there, so it has folate.
Now, are you also a big believer in some supplementation? Like you can get niacin through a supplement as well, all the folate?
Yes, niacin is huge because it helps to vasodilate our vessels. That means that sometimes when people feel a flush when they take niacin, it's a good thing because it's opening up your blood vessels. And again, sometimes we don't notice that we're stressed.
Very interesting. So we are so used to being in a constant state of stress that we can't identify when we're actually in it.
Yes, and I always say schedule some time to be still. I always say, go take a walk along the beach, Davis Island, somewhere. Just take a nice walk and ground yourself and just turn everything off so then you can reconnect again.
Even if it's just for a short while?
Just for a short while, even a 15-minute walk. Just shut the brain down a little bit.
Anything else that we need to know about the relationship between our gut and our minds?
Yes, it's so important for us to, again, rest and digest, and the reason why I talk a lot about that is because our food gets into our nervous system, and so what it does is that if we eat the wrong kind of foods, it really affects our brain function.
All right, Dr. Cathleen, I can't thank you enough for joining us on Bloom. It's always so great to see you.
It's great to see you, Gail.
Absolutely. We're going to